Good afternoon, everybody, and welcome to this, which is the third in the current series of neglect-focused learning webinars. If anybody doesn't know me, my name's Alan Small, and I am the independent chair of Falkirk Child Protection Committee. Also, I'm the chair of Scottish Borders Public Protection Committee, and I'm the current chair of the Child Protection Committee Scotland Neglect Subgroup. So it's a great pleasure to introduce today from Glasgow City, Mike Burns, the Programme Director for Child Poverty and Early Intervention, and Karen Dybel, the Assistant Chief Officer for Children's Services in Glasgow Health and Social Care Partnership. They have generously taken the time from their very busy schedules to speak to us about the developments of their family support approach to working with children and families in need. Both Mike and Karen have a wealth of experience in working in the context of local authority social work with children and families. They're going to speak to us today in the context of local authority social work and the partnership approach to how Glasgow has evolved and is reflecting the promise and getting it right for every child. And focused on improving support and early help to children and families, which is trauma-informed and attuned to the context of poverty and unmet need. In this way, it acts as a preventative to child neglect and works to build on strengths and keep families, children and families, I should say, together. It's really important work, and we've actually, this presentation or a similar presentation has been delivered quite regularly over the last few years, but things have really developed. And I'm sure what you hear today will really make an impact on you. So the work exemplifies the different approaches in many areas that are working to develop both strategically and operationally. And I'm certain that the input for Karen and Mike today will provide an excellent insight to this learning. So enough for me. I'm now going to hand you over to Mike or Karen, who'll say hello, and then they'll take us forward during their presentation. Mike, Karen, over to you.
So welcome from myself and Karen. We're delighted to spend a bit of time this afternoon reflecting with each and every one of you about the journey that we've been on, about, in some respects, changing the mindset of how we have continued to work and engage with children and young people, and also with families. Karen and myself have been on this journey for 9 years of working really closely with CELSIS, but also really thinking about implementation, but fundamentally thinking about how we secure better outcomes for children. And I think we want to just kind of slow down a bit today and take a bit of time to walk through with you. Whenever we do these presentations, myself and Karen are always really keen to stress that we do this with a kind of a sense of humility. We're actually learning as we're doing this. We're learning today. That's why we share it. We're not sharing it in the sense of going, oh, look at, what we've done. We're going to touch on today, I think Karen will, about the kind of ongoing financial challenges, the ongoing financial imperatives to shift the way that we're supporting families and to shift the way that we are, in a sense, deploying the money and how we're working very differently. The Child Protection Committee was really keen to, in a sense, cover this under the term neglect, and neglect within the context of child protection. But I think both Karen and I think Karen, like myself, but maybe even more so, we've gone through a kind of revolutionary thought process about starting our careers in child protection, but actually moving much more towards addressing child poverty and thinking of neglect much more in the context of inequality, and thinking much more about how we even frame the dialogue in relation to neglect. I think Karen will come on to talk about this, but I think Karen in particular has been really kind of key in challenging some of our thinking around even using the word neglect. Neglect is a word that we at times even confronted families on. We used it as a mechanism of child protection, but about 9 years ago, I think we started to recognise that despite really hard efforts, and interestingly, myself and Karen both went to what was then Paisley College. It wasn't even a university.
No, it wasn't. Paisley Tech.
Paisley Tech, it was called. But I think at that point in time, we probably both went in with a burning desire to see social change. And I suppose as you get absorbed into the life of being a social worker, the focus became during the 1980s and 90s, it became very much on those two initials, CP, which on occasions can mean so much about how we then characterise our engagement with families, and we're going to talk a wee bit about that. So I've moved on to do a work really looking at, the city started to look at child poverty as being, in a sense, the biggest challenge that the city's facing, both in terms of economically thriving, but also in terms of public sector reform. We've had fantastic support from Scottish Government and also from our own elected members. And again, Karen was just saying to me there, she was at a really fantastic kind of feedback with the Champions Board, with elected members kind of talking about the changes that they've had to make in their thinking. So I hope you enjoy our reflections today, and I hope you see them for what they are, which is about a really kind of painful self-reflection by myself and Karen about what we were doing for 35 years, some of us for 38 years, about the way that we were trying to deliver social work. When we went back and looked at this 9 years ago, we recognised that what we were fundamentally still trying to do was deliver on the Christie Commission about really, in a sense, shifting the focus from failure demand to what if we could get things right with families once, and what if we could get them right on a preventative basis. In terms of the work that I've been doing over the last couple of years, is that we've in the city deployed a really bright young economist, and he's been using a Manchester/Wigan model to look at what is the impact of child poverty in the city, just child poverty in the city of Glasgow, not poverty. And he came up with this figure saying it's probably costing the city between 800 million to 1.09 billion a year. And initially we thought that figure just cannot be right. But in actual fact, as we've journeyed on to look at delivering, getting it right for every child, to look at delivering the promise, when we've started to look at the amount of money that we were then spending on kids in care, spending on families too late. And remember, that's what kids and families were telling us, is we're just not seeing enough help earlier on in our childhood, is that we started to become, what if we really became obsessed about outcomes rather than actions? And we stole that line from Leeds, and in actual fact, Leeds City Council's coming back for us to kind of share learning with them. We wanted to be about saying, could we be the leadership team with our whole frontline, magnificent health visitors, residential staff, foster carers? Could we deliver getting it right for every child? Could we really link that into the promise, but also align the aspirations of getting it right with that anti-poverty and take a much different approach? And one of the things that I say to the elected members, even Scottish Government, UK Government and Council, is to say the most important infrastructure in the city isn't roads, and it's not IT, and it's not AI. It's basically the most important infrastructure in the city's family. And if you believe that, then you begin to get to a point where you say, well, of course, then the most important thing that we do must be parenting. One of the things that myself and Karen did, Karen in particular, linked in really closely with Paul Bywaters, and again, and we would ask everybody, we would encourage everybody to go and look at the work of Bywaters, Featherstone in relation to the Child Welfare Inequalities Project, because what Paul was saying to us at that point in time, where we would have said to you, of the kids that we had in care, the 1,469, we would have said to you, every one of them deserves to be in care. We would have said to you, every child on the Child Protection Register would say, we're fair in Glasgow, they need to be there. But Paul started to challenge us in a way that was basically saying, yeah, but your children that are in care are coming from areas, are overrepresented in areas of economic disadvantage. They're coming from your poor areas. And not just Bridge Featherstone, but Kate Morris, who's also spoken to Alan and spoke a number of years back, was saying, one would have to believe that all those with poor parenting have all moved into that area. And if you don't believe that, then what you start to believe is there must be a correlation between poverty at an even stronger level than what we believed. So one of the things that we started to look at was, again, if you look at that figure for Scotland, it was basically saying that that in the areas of economic disadvantage, there are 233 of the kids per 10,000. So this is on a per 10,000 figure. When myself and Karen started looking at it, if you'd said to me back 9 years ago, you'd said to Karen, how many kids have you got in care per 10,000? We would have said to you, no idea, don't know. But when we looked at that particular point in time, it was about, in Glasgow, it was 135 kids were coming into care per 10,000. We didn't even know what that meant. We didn't know if that was a good figure, if it was a bad figure. We just kind of goes, well, that's our figure. And we'll come on to touch base on that. But one of the things that we started to do was we started working really closely with Celsius. They operate at the top of the Bray that we are in. And we started to work with them about, let's start to interrogate the data and understand the data. And again, ridiculously, this took a year to do. It took me a year to put the budget of 166 million together. And what we then realised was, of that 166 million, we were basically spending 95 million pounds on care. We were spending 60 million of it outside the city walls, outside the city. And when we then looked at kids that were in our own residential care and in external residential care, believe it, we had both, we had 239 kids costing us 42.3 million pounds a year, while families were living in desperate poverty. And that seemed to encapsulate the inequality at a searing and embarrassing and angry. This slide angered us, because when we also looked at the data, we were then recognised there was not only was there a disproportionate spend, but Celsius were saying to us, did you know that in Scotland, 65% of kids that come into care go home? And when we looked at our data, because we then thought maybe our data will be similar to that or different, we were at like 63, 65%. So we were there. And we started to then think about, how might we use that 166 million differently? You'll see on the chart a wee slice there that says that the money that we were spending on prevention was basically I called it 3 million, 2 million and 1 million, but it wasn't even, the community support wasn't even 1 million, it was like 700,000. But in terms of that, we were saying we were spending basically £2 million right on the edge of care. And what we started to think about was about changing our approach to families and using COVID and using the way that we supported families differently. And we started to work and think differently about child protection and think about family support. I'm going to pass you on to Karen to take you through some of this thinking.
Okay, and I suppose every time we do this, and if we do it together, we think of something new. I just want to point out that me and Mike Burns have been qualified for more than 9 years, in case anybody's thinking we're looking really rough. And it's 9 for me of 35 years, really try to think differently about this. So I came into Glasgow in 1989. I was very much focused on poverty and inequality. My mum was brought up in care. I lived in the city and I was really keen to make a difference. However, when I came into the system, and how we subsequently brought other staff into the system is we bring them in, we support them, and we tell them stories about risk, we help them to identify risk, we train them in risk management, we put them on a 5-day child protection course. We then reinforce that by having regular local management reviews to talk about that population, and we share stories of increased risk, and we create systems to talk about and manage that risk. And I suppose we had, by the time we started in our transformational programme, really reflected on that, and we were beginning to get a picture. So, and probably worth pointing out, I think for all of us, that increasing challenge in recruitment of foster carers. When we started about 9 years ago, we had double the number of foster carers we have now. And as I understand it, that's not a Glasgow recruitment problem, but that's a national problem. So as we're facing some of the challenges in and around supporting families differently and better, we need to see that against the backcloth of a depleting number of families, alternative families in the city who want to look after our children. So we really began to think, supported by Celsius, and I think that's important, that to do this work, we've certainly benefited, and I think we would all reflect we wouldn't have been able to do it without that additionality. So that additionality has given us the backbone of research, the best current practice to draw on, and it also gave us the opportunity between sessions when we were trying to shift the culture in our organisation to really plan each session carefully and build on the previous session, and we just wouldn't have had the capacity to do that on our own. So the system to be, we wanted an organisation that's designed to support families to care and protect for their own children. So we weren't coming in as experts, we wanted to get alongside families. We want families and community to demonstrate their insights, wisdom and strength. So begin to get alongside families. We began to generate good news stories about families. We thought about the strengths and focus maintained about families, about their ability and capability to keep their own children safe. So we started to ask ourselves different questions. What would it take? How can we better support families? What do families need to manage the trauma in their own lives? What do families need to manage mental health challenges, substance challenges, learning disability challenges? And I suppose we've been talking more and more about neurodiversity in a kind of post-COVID context. So that will be, I'm sure, something that resonates across systems. So again, we wanted to shift our bureaucratic processes to begin to think about listening to families. And I suppose some of the advantages, Mike's talked about some of the policy drivers. So we were very careful to pick some of the messages from those policy drivers to help to reinforce and to help to think about how we could take the whole system with us to shift from care and protection to families as experts in their own life. What would we need to do? He's moving me on now. Right, next slide, please. So again, Mike's mentioned Paul Bywater, and I'm going to read this out because I think it's been really important, because this is not us reflecting on our practice. This is an external researcher who produced the Nuffield study. The transformation programme for children's social care in Glasgow has resulted in almost fewer than 500 children in foster and residential care, a third of the total in 2016, and a 60% reduction in the number of children entering care. A spin-off has been a remarkable 70% reduction in placement moves for children. These changes have been accompanied by and facilitated by a doubling of expenditure for family support. So our second iteration of family support investment was 6.7 million that we've invested over 5 years. And I'll come back to that, well, we will between us at some point. This has been based on a recognition that services were too focused on moving from risk to removal rather than in reducing risk while maintaining existing relationships. And that's crucial. And again, Paul Bywater, not us. So we created an organisation that's been designed to support families and to care and protect their own children. So families as experts in their own lives, thinking about moving away from that bureaucratic child protection process and shifting from the system as was to the system to be. And I think Dominique Harvey, who's got a background from himself, has been working really closely with us, has talked to us about some of the organisational traps in that work. So again, that's been quite challenging in a Glasgow context because we have a strong child protection focus still sitting alongside our locality focus on families.
Okay.
Okay, so the challenges, funding shortfalls, and I also mentioned, so for third sector, try to get alongside third sector, I don't know if there's third sector partners on, they were certainly reporting to us that the challenge for the third sector is repeated short-term funding. So what we've tried to do as we've created, driven and developed our model is create some stability for funding. So the first iteration was 3 years and this second iteration is 5 years, but giving us opportunity for a further 2 years. So we're really clear we want to get alongside the system. I think some of the commissioning challenges, which isn't in this slide, and I'm ad-libbing now, because every time we talk about this, we come up with something else. So some of the commissioning challenges, and when money comes in from Scottish Government and other sources, our ability to respond quickly as a system to get it out to partners who can deliver good family support. So families in distress, complex system of response and unclear pathways. So some of the challenges in and around that. And I suppose we've reflected on how good we all are at referring families on. We talked about the requirement of employing community connectors to navigate the system. So I think, Mike, you've done some work in the volume of community connectors, networking teams, right across the systems, including the Health and Social Care Partnership and the council. So we're spending money that's coming in at the city for families and to deliver services, helping people work out what services they need to go to. So some of that we've tried to really streamline and address. So we want a front door and multiple initiatives further confusing the landscape. So it's where the front door is and how we then are able to deliver services seamlessly to families and target the money to good services to deliver to families. So this is just a wee slide that I think that highlights the complexity of the system and just looking at trying to build on an already complex system. Thanks, another bit to that. So we tend to focus on snapshots of isolated parts of the system and wonder why our deepest problems never seem to get solved. So that's saying in 1980. And I suppose that again is when we're trying to improve things, instead of taking the time to reflect with in our example, Celsius, what do we need for cultural change to significantly change a system? And I'm sure around the room that will resonate. We build on what we've already got. And I think it's been really important for us to take the time out to reflect.
Yeah.
Okay, so that was some of the challenges. So the opportunities are that we've been learning from what's working well. So we invested in intensive family support. And we're continuing to think about that model and how it can be developed and reach further. We have been working hard to think about alignment of funding to meet the range of families' needs. And again, so Mike's here. Mike was previously doing my job, and we found that interface really important. In my head, it's a Venn diagram, a bit coloured in the middle, with colleagues from the council and the HSCP working together to see if there are funding streams that we can align to think about how we can target services for families. We wanted to build on existing strength-based and trauma-informed practice with a longer-term aim, and we wanted to move away from a referral culture. Talked about that in the last slide about connectors, and we wanted to support families holistically to achieve meaningful change. We wanted to align to the Child Poverty Pathfinder, Whole Family Wellbeing Fund, National Child Protection Guidance, GIRFEC, Christie Commission, The Promise, and we've been working quite hard to look at where we can engage stakeholders to talk about these policy directives and where the join is so that we can better get together as a system to work in the same output for families.
Okay, this is so I mean, maybe just picking up some of what Karen said is it's probably really important. Maybe it might come up as a question and we can myself and Karen can talk about in more detail. But one of the things that people do reflect back to us is, how did you create a container of that risk going from one system to the next? And again, this is probably where I give the greatest kind of credit to the likes of Karen, who was a head of service, but also knew the service managers, knew the kind of decisions that were getting taken. But we tended to then use that intensive family support as a mechanism. We actually went to Wishaw, believe it or not. We went to, and what I mean by that is, we'd previously tried evidence-based programs from America. We'd brought in stuff from Seattle, we'd brought in stuff from Washington, you name it. But in actual fact, what we started to look at was the fact that North Lanarkshire Council were doing this brilliant intensive support to 10 o'clock at night and on a Saturday and Sunday. Who would have thought of that? But what we started to do was we started to give everybody permission, health visitors, social workers, and probably most of all families, the permission to allow the short-term challenge of that risk to be managed through. And I think that Dominique kind of talked me through this, because sometimes Dominique has said to me, Karen, this is what you did, and I didn't understand this flowchart for a while. But actually what Dominique was saying to us and what Karen was reflecting on is like saying, and delivering the promise at the bottom of this spectrum, you think, oh, what I need workforce numbers, I need more social workers, I need more residential. Or you think it's workforce configuration, I need a restructure. Or you think it's pathways, policies, process and legislation. Or you think it's care inspectorate. But in actual fact, what Dominique's saying to us and what Donella Meadows is saying is that what you really need to concentrate on is a culture and paradigm shift in that dialogue with families, that you need to listen to families. So one of the things that we started doing was, even when we were doing the intensive family support, bringing families into the room and getting families to really talk to us. We did a family support strategy. Karen did 80 families. We did our children's service plan. We did at one point in time with 1,325 voices. So you're really getting them to kind of come in and take a different approach to what it is that shifts the system, that shifts the culture and takes you to an entirely different place. And one of the things that we've been chatting a lot to in relation to the Scottish Government is saying to them, and also now council leaders in Glasgow City Council, is that we too often think of the strategic solutions at the front, Scottish Government, legislation, policy, council, same. But what we forget is what that reality that Karen's talked about what it's like for the family, those touch points, that initial interaction, whether it's with the financial inclusion sector, whether it's with Money Matters, whether it's with a family support, is saying, what does it feel like for them? And what we've then tried to do is bring that family's lived experience into influence our policy, to see that the leverage points that you'll see that's been captured in this is at the frontline practitioner, social work, family touch points. So picking up that point that Alan was saying earlier, that what I'm then doing is I'm frequently meeting with either Scottish Government or, we've had other authorities down in England, and what we're saying is we know this, but you've got to pay attention to what is happening in your system on the ground for that family. What does it feel like for that family? So you want to come in on that?
I suppose it was just to be clear from the slide. I suppose traditionally for all of us, what we've done is we've thought about policies from the top up, thinking about Scottish Government, thinking about Council HSCP, thinking about ACOs, heads of service, practitioners, to families. And what we're trying to do in the context of the work in Glasgow is shift that, so that we're talking to families, the third sector, health visitors, and we want to hear what families think they need from us. And we want that then to influence policy, senior managers and the council. And I think creating those leverage points. How are we able to do that? And we think that's where the opportunity to really affect significant change lies. And that's what we've been trying to do.
Yeah, when we started this programme, and Alan would know this well because we've reflected with him, it initially started with, can you just reduce some of the high cost external placements and bring down some of the financial challenges that we're in? And I'll come on to talk about that. But when the numbers started to go down, and they started to go down to the extent myself and Karen at times were perplexed by even more of the numbers going down. And in actual fact, what we started to understand was that health visitors, family nurse partnerships, social workers, teachers were starting to change the conversation with families. The third sector was starting to do brilliant work, had been doing brilliant work, but started to do it in a much more targeted way with us about what it felt like for families. I think this is your slide. He said, passing, because I think you passed the last one to me and I think it was yours.
You just take it, doesn't matter. So I suppose what we've been trying to do is shift the power and control towards the preferences and priorities of children and families. So we wanted a strength-based practice with shared values and ethos. We looked right across partners, so Nurturing City, that's really education partners. So we were really keen to create a model that resonated across the city, and we were trying to work with people so that people didn't stand back and observe our change in practice and worry about it. And I suppose that's what we found really important in terms of developing the model. Because as Mike says, we went to Wishaw and we quite liked what they did, and then we met with the head of HR here to look at whether we could do our own in-house model. He's thinking that's not what it says in the slides, but I'm saying it anyway. How can we do our own in-house model? And I suppose what we've tried to do in doing that is create that genuine partnership. So with Celsius, so that we were able to say, look, we've looked at the best research, we've got support to do this. And instead of doing it ourselves, we did it on a commission basis with third sector partners. So we get the added value of all the skills, knowledge and expertise of all the partners we brought in. And we were also able then to work across systems. And it meant instead of education, perhaps third sector partners looking over our shoulder saying, well, we're a bit worried about that reduction, we had those partners owning that reduction and working with us. So Child Poverty Pathfinder, you know, poverty is the main only agenda, common enemy, and the only agenda in the city. Well, that fits really lovely with what we're trying to do in terms of working together. We worked really hard to create a model, and we involved frontline staff in doing that. We didn't tell them what the model was. We were supported, and we did it together with third sector partners, and we came up with voice, validation and hope. We also were keen to share the model with Police Scotland, who had a public health approach. We wanted to get alongside them, bring them with us, and we felt we were absolutely pushing an open door where everybody was really keen. We've mentioned family nurse partnership, and for folks involved with family group decision making, that kind of ethos, the strength in families and try to bring out the strength in families. And we've worked really hard with Children's Hearing Improvement Partnership to get that message across, because again, we don't want agencies sitting with us and looking over our shoulder and feeling anxious about those changes. So people saying, oh yeah, family support, that's really good, but what about child protection? And I suppose we've got staff in our teams saying that good family support, good relationship-based, strength-based, trauma-informed family support, what is that if it's not child protection and protection children? So we wanted to get towards a strength-based model. Communities and neighbourhoods we wanted to do, and I suppose we would reflect where we've got to. COVID came along, and I just wanted to point out that a lot of this was done in the context of COVID. So COVID came along, and it meant that we weren't able to drill down in the localities as much as we'd like, and we're still working on that. And I think Mike will come back to some of the work he's doing and some of the development that he's got that actually begins to do that. So if we do it in partnership, it gives us a drill down. So we wanted to shift from a paradigm of risk towards mobilising family assets. We didn't do it in one day. We did it in 9 years. We brought people with us. We scrutinised the landscape, we looked for messaging, we looked for messages of support. The promise came along at a really brilliant time for us, and we really felt the messaging from the promise resonated with the work we were trying to do in the city. Please note, in that order, not the other way around. Developing long-lasting trust and relationships, and keep the promise. So beautiful recognition there, and an opportunity to allow us to gain trust with partners across the piece. Really keen to invest in staff as our most precious resource, towards using our precious staffing resource towards really engaging more positively with children and families. What do you need from us? What will it take to help you? And asking ourselves, what is it for this family? It might be 30 hours this week, it might be 50 next week, and then we work really, really closely with those families to try and reduce that. And I think some of the work in Mikey's new post is doing, and I don't know if you've got it written down anywhere, but beginning to think about employability opportunities, so taking that step further all the time, that we've had families who were in need of our support, but we're thinking about addressing the issues of poverty and inequality and try to support those families at work.
Brilliant, brilliant. Thanks, Karen, that's brilliant. Just in a sense, probably going through some of the points of leverage and some of the changes, because one of the things is just that way is like we've tried to really promote a prevention, earlier intervention and well-being, and for those that are on the call, and again just came for a conversation with colleagues this morning saying we've been too lax about prevention. We've just expected prevention to happen, and one of the things, as Karen's saying, is to use a Celsius element is the same. We need to get much more intentional. We need to get much more disciplined about what that actually means. And part of the thing that we've looked at in relation to that scaly 800 million potentially child poverty, that we're actually saying is it's neither ethical or sustainable, and that's why we need to, in a sense, be focusing in. What we've begun to see is we've just been missing prevention with families. They escalate into acute, and then the cost for everybody, but most of all for that child and for that family, is massive. We've tried to take the Verity House agreement, but take things like, Christie, we're still saying it's, and actually link that to the council's grand challenge on reducing poverty. And just that kind of point there, as we're saying, we've really now made poverty not on the agenda for community planning where it was before. I used to go to community planning meetings and item number 4, house things. We've actually now made the whole of community planning is we need to reduce child poverty. And one of the things that we did during COVID, simple things, is we started to give health visitors, our health visitors who Karen now line manages, we gave them access to Section 22. We were saying to them is, see if you come across a situation, don't refer it to social work. There's no need for that family to go through social work. You give them the cash first, you give them an emergency payment. And interestingly, we've then had Police Scotland saying to us, well, what if we saw a family at night or at 2 o'clock in the morning? Could we make that emergency payment? And we're kind of going, well, why not? We need to look at that, and we need to look at the third sector's access, because our cash first approach has really, really worked with families. I'll come on to say a wee bit more about that, but we're really focused in on health visiting. We've gone from 150 health visitors to 274. That's slightly gone down as part of the financial challenge. But what we've started to do is give family nurse partnership, breastfeeding initiative, giving them access to Section 22, trying to really radicalise that investment in family support, but recognising, as Karen made the point earlier, the cost of care is just becoming unsustainable. And if it's unsustainable, again, one of the things that Karen said to me in the past was, the greatest way of delivering the promise about keeping brothers and sisters together is to keep them in their family in the first place. So that's some of the things that we've tried to look at. In terms of lifting some of the bits out of the promise, we've talked about the fact that there must be significant and ongoing and persistent commitment to ending poverty within, and that's on page 18 of the promise. But one of the things that we tried to do was that when COVID-19 came along, people were saying, oh, more and more kids are going to come into care. In March 2020, 2020, which will be coming up for 5 years. And one of the things that myself and Karen said is, no, we're going to treat this as a humanitarian crisis. And because of the good progress that we've made, when Scottish Government gave us 4.8 million for residential care over time and for other things, we were actually in a position where we gave £3.3 million of it right out into families. And we said to families, kids on the register, kids on the educare, kids, young people, families really struggling, we gave them £400 a child. And we just said to them, we're putting that right into your bank account. We're not asking any questions. And in that January 2021, when we did that exercise the first time, only one child came into care. And you've got to think about that. You've got to think about, and I know people say to me, even Karen say to me, yeah, but that was during COVID. And I'm going, I know that was contextually, it was a unique point in the life. But one of the things is that we have then significantly reduced the number of kids that were taken into care a month. We've gone from 32 kids coming into care a month to now much, much lower numbers. So we've started to think about that point that Karen's making about empowering the organisation, empowering the front line to just ask that simple question with families from the get-go. What can I do to help? And again, one of the feedback for families is they've said to us, you know, it often felt like you used to come and wag your finger at us and tell us what to do. It feels very different. But when we gave that, you know, we then seen kinship care, instead of saying, oh, we've got a budget of 12 million that we're giving out to kinship carers, we've then started to see that as an anti-poverty strategy and actually an asset. We repeated the winter social pressure of giving £400 out. The council did that and the HSCP did that a second time as part of the cost of living, and it just, the cost of living crisis, and it just actually showed the impact of it. Parents and carers came back to us, and interestingly, one of the things that we got, like North Lanarkshire Council did it, we asked parents to fill in a text questionnaire on what it felt like to get the £400. And the biggest thing that came back is that families were saying they really felt respected and they really felt dignified by it. And again, you go back to me and Karen starting her career, that's aligned to your values. That's aligned to what it is that you're trying to do. So one of the things that we're kind of looking at is how do we transform roles? How do we create a multidisciplinary team? And how do we kind of keep going in the direction that we're going in? Getting near the end, you'll be glad to know, but this is in a sense just kind of echoes where we got to with that work. We started with 1,413, and in a sense kind of 100. I've since known that the figure's 1,469 kids in care. We would have justified every one of those kids to you. And today we're sitting at, I think, 597. I think it went up a couple. But that's fine. You know, we're basically saying that we're seeing a massive reduction. And one of the things that we really like to highlight is of that 597, only 86 of the kids that are in care in Glasgow are under 5. And let that sink in. Let that sink in about the kind of scale of change. What we didn't pay attention to, and Karen's just going to pick up this slide, is we didn't pay attention to child protection, but that started to change. Kids on the register.
So I suppose we didn't go out and say to staff at any point, right, we want a reduction of 100 by next year. There was no figures discussed at any point. What we've done is carefully got alongside our staff and changed the culture. We're really clear, and people will be really clear about the external financial pressure we're all now under, and we are all under the same pressure. So we were accommodating a child last week and we looked right across Scotland, we couldn't get a foster placement. Now I know that's not a Glasgow issue. So again, for all of us, we're really having to think about those external pressures. So at no point did we address the issue of the number of children within the child protection register. We didn't do that explicitly. We didn't even do it implicitly. We didn't set any targets. But what we've managed to do while we've halved the number of children in our care, and it was only after a conversation when we were looking at the numbers of registered children, we've halved the number of children on the child protection register. And I suppose that was never about saying to staff, we want you to reduce the numbers, but what we did is change the culture and change the approach to working with families. So social workers were going out and seeing poverty and inequality and getting alongside families to say, right, what do we need to do here? What can we do differently? Are there things that we can do in this family home with our health visitors, with our social workers, to reduce that pressure of poverty? And we've done that instead of calling out the neglect. Now, you could frame that in a different way, but what we're saying is we want to help families in any way we can look after their own children to the best of their ability with support from us. What would it take? How can we help you? What do we need to put into this family? Because buying some furniture, replacing some carpets, supporting those families in the current financial pressure we're under is much cheaper than looking for a placement. So what can we do to get alongside those families, to hear them and what they need to affect and maintain change?
Brilliant. And I think, again, just echoing Karen's point there about, going back to that slide, in actual fact, we've been chatting to somebody externally, and one of the things that they were saying to us is it feels like in doing the work with families that we've actually have them move families from crisis and risk, and we've at times we've seen tangible changes in families. And again, we did a thing recently, and our colleagues in the third sector were saying to us that they'd been speaking to families, and that families were saying to us, we just feel there's a nicer dynamic way, social work in particular, not health visitors, but just feeling that there's a much more supportive sense of where we're at. Just about to finish up, just a couple of last slides. So you can see the bit that we're saying is we've reduced, Paul Bywater's bit was saying we'd reduced kids by, nearly 500. It's now at 877. That bit that I was saying to you about, rates per 10,000. In actual fact, when we started this, we were at 135 kids per 10,000 in Glasgow. Paul Nixon was saying to me, who worked in New Zealand, was saying, that in America, they've roughly got about 100 kids in care per 10,000. England, about 110 per 10,000. Canada, Australia, 80 kids per 10,000. But New Zealand, very low at 40 per 10,000. So an exceptional bit of cultural work that they do. Same issues around addiction, mental health. It's the approach that they're taking. And there's Glasgow, we've come down to 53 per 10,000. So it's a seismic shift going for 32 kids coming into care a month. Think of a single decker bus going round the city to now much closer to 5, 6 a month. It means that 877 kids, Glasgow kids, are at home. It means, as I said, there's only 86 kids in care. We've secured savings of 29.1 million, which obviously interests the financial people. But also picking up Karen's point is if those 877 kids were in care today, they'd be costing you in excess of 70 million. And you would be like Nottingham and like Birmingham, you'd be bust. So the bit that, again, that our family support has moved from that, remember that wee yellow slithery 2.7 million, it's gone up to 8.7 million. But when we're then starting to join it up with community fund, the community fund's about 18 million. I'm already in that 800 million, beginning to see easily 106 million of preventative spend that's just not connected up well enough. And again, I think we want to leave you with a couple of points about we need to align the preventative spend more effectively in relation to cost-benefit analysis. We want to probably even move away from using the word youth justice, because we think the kids that we're working with here, it's still trauma. And we want to think about that in neglect, and we want to think much more about inequality. And fundamentally in Glasgow, it's been about a strengths-based, trauma-informed, and we want to get to trauma-enhanced anti-poverty approach that means that we can deliver for the kids in Scotland, in Glasgow. So we want to leave you with some of these questions as a call for action and lessons for children, for our national leadership, for everybody's on this call. How might we get more deliberate, intentional about defining prevention, early help? What are we noticing? What are we attending to? How do we develop more openness about implementation? How do we make sure that we're capturing that voice of lived experience? I think we've shown some progress on it. We still want to radicalise it. What do we mean by collective leadership, and how do we do that more effectively? What are the enabling conditions? And what do we continue as a group to learn? So I hope that hasn't been too difficult to listen to. We're keen to now move into the section where we can hear from yourselves in relation to any kind of comments, questions. We haven't been paying attention to the comment chat, but we know Alan and others have. Thank you.
Thank you, Mike, and thanks, Karen, for that. It always moves on. Every time I hear you presenting, there's more. And I suppose that's just natural. It just shows the journey that you're on. Okay, folks, and I'm delighted to say we now have got a raft of questions. So I'm going to kind of pick off a few. I don't know if we'll have time to do them all, but there's a couple around about the Section 22 payments. So one question is, if you're allowing different agencies to access them, does it register if the same family is accessing this on several occasions? And the question isn't around about fraud perspective, but I suppose it is to say, you know, are some families in greater need, and actually are you picking up on that? And is there an escalation process that might lie behind that? And on the same subject, so I'll just wrap this up as well, recognising the cash first approach and encouraging staff to ask what would be helpful and tangible practical support in their hands. What initial steps did you take to change the culture and move the staff, and in fact the whole system's appetite to risk, and you know, get staff bought into it? So I don't know who's best to answer that between the two of you.
I'll go on that one initially, Alan. And I see some of the questions in the chat, and I think there is a lot in that. One of the things that we've committed to with Scottish Government is to become even more precise, more deliberate with the position in relation to data and in relation to what actually is the funding, what is the actual income shortfall for families. And I think we've been really shocked by a number of things. Firstly, that, and I'll take responsibility for this, is that in your busyness in social work and health visiting, we didn't, despite all of this work, we hadn't had conversations on the 2-child cap, right? We hadn't actually gone, how many kids have we got where that's affecting, that they're not getting child benefit. But also in terms of the data, we started to really look at not just poverty, but deep poverty. And we started to understand those groups that the Scottish Government have identified as, we have 5 or 6 priority areas, which is single mothers, kids, more than 3 kids in the family, children with disabilities. But when we started to look at the figures with myself and Karen's new colleague from the council, he was then saying to us, the impact on Carlton, on Gorbals, on Castlemilk, is that these numbers of kids are living, and they're £170 a week, the child, below the poverty line, right? So our understanding of poverty, it just blows your mind, because although you're then going, we've got kids in poverty, what we're then talking about is both deep poverty, and that then probably got us to a point where we're having conversations about how do we radically move, like, for instance, things like the Scottish Child payment of £25, because we're then saying to the government, even if that goes up to £40 or £50, the depth of the problem that you've got is immense. So one of the things that we're trying to do with the Section 22 payments is just make the point that before you start helping families, on occasions, picking up Karen's point, is we need to get real with the scale of the problem. And I think for us in social work, again, our colleagues just passed there, Liz Simpson, and Liz would always say to us, welfare rights we did in the 1990s and 1980s and 90s, we did them. And because of cutbacks, you start letting welfare rights workers go, but then nobody's doing it. And then we've got this massive financial inclusion sector that needs completely overhauled. But in the midst of that, I was saying to Karen, we came across a family only a couple of weeks ago, 7 kids, and not one of the children getting the Scottish Child Payment. To do with English as a second language, that family's lost out on £10,000. And what they've also lost out in the duration of that is £17,000. So it starts to tell you about, and again, I'll answer the question and Karen come in, that sometimes the attitudinal problems we used to audit families that were coming in and asking for money. We used to cap vigorously. So a team leader in Glasgow can make a decision to place a child in a £500,000 a year placement, right? But that same senior, she or he's not allowed to make a £70 Section 22 payment. And you go, the system that is crazy. So what we've tried to do is push the permissions in a different way. I don't know what you want to add to that.
So I suppose just practically though, obviously everybody's aware health visit is a universal service, and what we didn't want to do was escalate families to requiring a social work service because they were short of money. What we wanted to do was try and support that family at the earliest possible stage. So the health visitor, universal service provider, can say that wee family's struggling this week, I'll arrange a Section 22 payment. So suppose it could be the case that you would have health visitor and social workers, but you would hope from a practice perspective that if there's an allocated social worker and we've got a single management structure in the city, I know that's not the case right across the country, but in Glasgow we do. So that would allow us, and I would be expecting the health visitors to start to talk to the social workers when they found the family that was allocated to a social worker really struggling. So it's about keeping an early intervention approach and not escalating families because they need a wee bit of money on a kind of a regular basis. The police aren't able to do that yet, but it's something we would want to plan.
And a couple of things that people might be interested in, and I'm not saying in Glasgow I'm not saying we're going to do this, but our Director of Finance is then starting to work out that if we're spending 60 million on care outside the city, would we not be better to inwardly invest that money in our own families and actually sustain? And I think that gets us into conversations that we are having with the government, Alan, both Scottish and UK. So we've had recent contact with the Minister for Employment, and she was equally saying to us, this is fascinating about the issue in relation to what we can afford in relation to benefits, because you might say, well, UK government might go, we can't afford to give families X number of pounds. You go, yes, but Leeds City Council and Newcastle and Glasgow are paying for it by the failure demand side. So we need to get deliberate and radical about what prevention looks like. Because again, picking up Karen's earlier point, and the work that we're doing now, we're beginning to see that route into poverty, that route into employment out of poverty must have income stability to enable families to move into some element of employment. If you don't have that income stability, how in the name of goodness are you going to get transport, childcare, and get into all the mechanics of doing a few more hours and earning more money? We've got to get radical on it.
I mean, you make a valid point. So not only you've been radical, but actually the bean crunchers will like it as well, because from a cost benefit analysis point of view, you're actually saving money. You're helping people and you're saving money.
Yeah.
And I suppose it's having that culture change. And there's a couple of questions about culture in here. Is how did you how did you actually get that message over to staff and get staff to be more relaxed and be on the same page as you, but also senior management? How did you get the leaders in the city to buy into it? That's maybe
Karen go question.
So I'll let Mike do the bit about the leaders in the city a bit more. I suppose on a front line, what we were able to do, so a whole number of things all at once or lots of busy things. So not one single thing, but a number of factors. So thinking about the context we were working in, what we were beginning to gather, and for us 35 plus years, is we were purchasing high cost placements to no good end. We were able to say, look, we've invested in out of city placements that might have been up to £1 million for some children, and then they were involved in criminal justice, and they were involved and they were homeless, and they were really struggling. So from our perspective, we were able to use that data. We were able also to say, look, 6 in 10 children go home. So we've accommodated all of these children and the numbers described, so more than 1,400 children, and 6 in 10 of them are choosing to go home as soon as they can make that decision. We also were beginning to look at foster placements, and we got some brilliant foster placements, but we were also able to determine and scrutinise that we had a number of children coming in and they were having 2, 3, 4, 5 and some placements before the end of their care journey. So we were able to speak to that. And I suppose, I think, in getting alongside staff, being able to say, look, we are addressing the risk in the family home and removing the children. But in removing the children, we're not necessarily reducing the risk. So our young people in their teens, 14, 15, 16, we were bringing them into care. They might have been placed in a children's house, and we were beginning to see the same behaviours that we were worried about at home being replicated in the children's house and sometimes escalating. And what we didn't point out in the slides, probably in 2016, we had about 35 young people in secure care. And at points we've had none. At the moment, we have 4 in the city, and 3 of them are sentenced or remanded. We only have 1 child on an order. And again, with the same principles. And in that secure screening context, bringing partners with us and able to describe that when we were bringing children in, we weren't seeing the evidence that told us we were getting better outcomes. So we were able to describe that over time and provide evidence. And then we were getting things like, and people will recall the EV judgment, where a sheriff came and said something like, some children will be harmed in the course of their childhood. So what you were saying is, look, we're not looking for perfection here. We're looking to get alongside families, and just because the children come into our care doesn't mean it will be better. So what do we need to do that foster carers have? Can we give what foster carers have to families and give them the best chance they can to look after their own children?
Yeah, in that question on how did we change, or how did we change the culture? I suppose the first thing that we did, and the biggest thing that we did, was we listened. That and that bit that we were saying earlier on, we stopped imposing evidence-based programs. We stopped we just said to everybody, what do you think? What do you frontline health visitors, FMP, school nurses, CAMs, we just said to everybody, social workers, residential, what do you think? What do you think about, what do you think we're doing well? And I think in some of the questions there are like saying, how did you bring that work in from North Lanarkshire? We also then, we gave a lot of permissions to people. So our 2 team leaders, who maybe both of us have tried to promote at times and have just kind of gone to us, leave us. We love what we're doing. And, we get on with really concentrating on the ability to engage kids. And I think people felt, Alan, a real sense of going back. We talk about kind of mind and heart. It's, yes, we did a lot of intellect on evidence and chatting, but fundamentally you're also saying to people, why did we come into this job? And very few people came into the job to take kids into care, to put kids on the register. We came in to help families. And I think we gave people big permission, as Karen has kind of reiterated through that, about what will it take? And staff started coming back to us, and they started to then change their local things. They started to change the way, we started to challenge things about the way the words that were used, the way that reports were written. We started to change the conversations in terms of child protection case conferences, you know, that we started to, in a sense, look at things through, you know, and again, going back to one of the things that Karen said there, when we looked at this initially, we also had a 14-year-old kid that came into care with some challenges, disability challenges. And she stayed in care for 4 years in her own provided care, but it cost £1.4 million to keep her in there for 4 years. And where did she go at the end of the 4 years? Where was the only place she could move on to? She went back to her mum's. And you have to, at that point in time, and say, is using that 1.4 million. So, I mean, I've had a lot of really good support from the elected members. I think the elected members initially, Alan, will be quick. Some people probably tapped into some of the money. Some people tapped into, we can't keep spending like we're spending. So we started to, even the bean counters across the road started to go, what is going on? The children's services is no longer, in 2009, whatever it was, we stopped going overspend. We started to then come in with massive underspends. And that then got the chief executive, Anne-Marie O'Donnell. It got the elected members, and the SNP cabinet have been saying to us, keep going, keep doing what you're doing, keep being radical. And the elected members and the IJB are really proud of what they've achieved. They see it as their, quite rightly, they see it as their achievement. So giving up power and giving up, you know, myself and Karen do a lot of listening, and I know that might come as a surprise given how we've rabbited on, but that's a lot of the time what we're doing.
So thanks for that. And I think within both your answers there, you've kind of covered a couple of the questions, which are around about thresholds and appetite for risk, and whether you've actually changed that. But I think the examples you use, well, you know, what actually is the point of taking a kid and putting them in care for 3 months or 6 months or until they reach the age that they can voluntarily leave care? If actually they just return home anyway, you're probably better spending the money to improve the home environment and make the home safer. But I suppose that takes, and I can see it myself, having worked over a few areas of Scotland, that takes a bit of guts, because the safest way, or the way that we know to keep children safe, is to put them on the Child Protection Register or you know, have a CSO or a CPO introduced. So you need to have that. You need to have that feeling of confidence that your system's going to work. But I think over the time they're starting to demonstrate that. There are a few questions in here that are kind of related to that. Around about resource. So there's a couple of questions. One asking about what about the resource? Is there a freeing up of capacity through this approach? Because, you know, it obviously it takes a lot of time to have the meetings, do the paperwork, and go through everything, have the review meetings, etc. Kids that are on the register or are in care. Not just from a social work point of view. There's a specific question in there about health teams. And, you know, what they're doing with their time now that they're not doing this. And recruitment and retention, has it had an impact on recruitment and retention?
So what are they doing with their time? So we are not saying we took risk and the risk doesn't exist anymore. So we've got more families in communities, and for some families it works really well, so you can turn around quite quickly and you can get in, offer support and exit. For other families, we might be thinking that we are in those families for the duration of their childhood. We're working in a different way. We're working to support families, and we're working to talk to families about what we need to help them with that day, that hour, that week, to keep the families together. So we've got that. As you know, health visitors work to a universal pathway, and in that universal pathway, they'll have a number of families, and for those families, every family is offered a number of visits that are standard visits, 8 visits, and then there's a capacity within the caseload to increase those visits for children that are more vulnerable. And what we are then saying is those children are more likely to be at home, but they might then need a bit of additional support. And obviously we've got the demographics. We've not talked about homelessness today, and homelessness in a city of Glasgow has quite a dramatic impact on the city. There's a number of families, there's a number of single adults waiting for accommodation, which also impacts need. So as we've maybe reduced some of the needs, we can see increasing need. We've got families with increasing leave to remain. We're looking at more families coming to the city via asylum seeking routes. So we've been able to think about how we develop and respond to need as we go on. And I think Mike's indicated that we probably would have sunk financially as an HSCP had we not made the changes that we've made, because all the time, and I'm sure everyone's really feeling this the same way as we are in Glasgow, that increase in demand in your service. So it's allowed us to continue to deliver those services in that financial framework, otherwise we would have sunk.
I mean, it's tough in terms of answering that question, Alan, because one of the things is that, you know, the budget's gone from 166 million. I think Karen's got a budget of about 162 million now. But the challenge is getting tougher, and it's getting really fragile because we're beginning to see a wee bit of a reduction in health visiting because the budget's getting constrained there. We're holding on to vacancies. I think we did have a really positive period where we had really good staff retention, and with a lot of staff wanting to come and work with us on the back of this. You know, so we saw people actively applying to come and work. I think it remains, my new role is about the fact that it goes back to the presentation that we've given you, where we're saying the only show in town's got to be early years and earlier intervention. We've got to get it right for families once. And we've got to move in a much more different direction. It's got to be that. So I think the cultural leadership that we've got in terms of chief executive, politicians, but the devil's in some of the financial detail. And I think myself and Karen would still say that that is going to remain a bitter fight to ask Scottish, and again, to be fair, Scottish Government have been really positive about coming out and meeting with us, because with a meeting with Shona Robson, the Finance Secretary, we've had our, you know, Karen said the elected member saying to her, it's very unusual to reduce the spend that we've reduced and get better outcomes. But there is a challenge here, you know, and again, there's some interesting things. John Summers in the chat has talked about, you know, again, our figures of kinship care has actually amazingly gone down as well. So we've gone down from about 1,300 kids in kinship down to 824, 25. But also picking up John's point is the number of kids that we've actually got on compulsory supervision orders at home is actually really, really small. And we can share that through Joseph and Michelle. We can even, you know, if Joseph and Michelle want to pick us up on some of these questions, we can write back to people so it's available. But things like, for instance, going back to Paul Nixon's point, going back to the Child Protection Register, I think I've had this conversation with yourself, Alan, is if we getting it right for every child right, and if we start to make families flourish, then everything starts to come down. And again, one of the things that we're saying is, even that's surprising, because you could argue, well, if you go 877 less kids in care, surely your numbers of home supervision has went through the roof. Well, it hasn't, because we're generally trying to work with families. So the need for compulsion, picking up John's point, has actually significantly gone down. And I think that's going down as a light of the promise, getting it right for every child, and the cultural change.
Okay, so I'm going to pick up one other question because we're running out of time now. We've got 7 minutes left, but I'm keen to know whether you or Karen, because you're obviously able to see the Q&A, whether there's anything there that you're burning to address.
I think someone's asking for the Manchester-Wigan economic model, which again, I can get that to Joseph in terms of what Hassan's done. That's our economist. And I think I've called it right. The bit that Heather's picking up in relation to minority populations, again, one of the things I would say to Heather is, you think you understand things, and you think you're aware of the scale of the problem in relation to asylum seeking and, you know, pockets of populations that we have, for instance, the Roma community, etc., etc. But we're trying to give ourselves at the moment the data on English as a second language in Glasgow is over 100 for some areas. It's over 100 languages. So me and Karen would go like 2, 3, 4 years ago, we think the problem's X, but when you get the data, you go, it's mind blowing what the problem is. And we're picking up things through the work that we're doing is like loads of families that can't read and write in their own language, which you wouldn't, you know, it's not just that they can't speak English, it's the fact that their skill set in their own language is really, really remedial as well. Who knew? And that's the bit about Heather's point. It is about layers upon layers of, we need to get to the right people. You know, we need to be much more targeted. We need to get the prevention right so that social work and CAMS, the acute element, is dealing with less and less people.
Okay, we've got a couple of other questions. I'm going to touch one. The specific question about, will you share your slides? I'm not sure, Joe, whether we can do that with this type of, whether we've got the emails address, everybody that's signed up, or whether we just have to rely upon the webinar for that. But I'll leave that with yourself and Michelle. Questions about the graded care profile, which I know you've adapted, or we can't say that, but you've certainly got your own model, and whether you've got a specific neglect strategy, and if you do, whether that's shareable.
Go for it.
So our specific neglect strategy is family support.
I suspected that might be the answer.
That's right.
And then how does it tie in with the Bairns House? Because you've obviously got a Bairns House pilot in your area as well, you know.
So we don't have premises in the area, but what we have is we have a team of staff, a really positive team of staff. So we're really clear. We are trying to prevent child protection for children. We're trying to get alongside families. We're trying to manage risk earlier. But if we have to interview children, we want to do it in the best possible way. So we've invested in our team of staff who do that really well. And I think we've had some really positive, there was a really positive report into the work of our team in the city. We don't have a physical Bairns House, but I suppose what we've tried to do is create high quality services where children can come in to spaces that are positive spaces. So we don't have a Bairns House, we don't have the money for a Bairns House at the moment, but the ethos of a Bairns House and the work in some of the funding that you're able to apply for, we've applied for, and we're looking for the psychological safety and support our staff who are intensely involved in interviewing children on a regular basis. So while I'm saying our neglect tool is family support, we absolutely are committed to the best possible standards, and we want to support children as best we can. So we're also invested at the other end of the scale, but not specifically in a Bairns House, but we're invested in the ethos of a Bairns House and the support for staff who are interviewing children regularly.
Okay.
So I guess you're using the standards, but you don't necessarily have the facilities for it. I mean, that was a
That's
nitty
right.
question for me, because I thought the Children's First facility was in Glasgow, but I think it's North Strathclyde.
It's in, I think, I'm going to say it's in East Wren. I might be wrong about that, but it's on our doorstep, but it's not ours.
A snap for Fife. I think everything over there is Glasgow.
If only that were the case.
Okay, so we've only got 2 minutes left, so I think I'm just going to use it to wind it up. And thank you everybody who's stayed with us, even with that 5-minute break, because it's always a bit of a risk to take. People say, "Oh, come away." But I think the fact that we've had 2 enthusiastic and such enthusiasm from our presenters, and the fact that this is, you know, it's revolutionary stuff, really. It's and it shouldn't be, because it's pretty basic, isn't it? That it's all done to I suppose it's a spend to save model, but I think it's outcomes that actually really matter. Let's not think about the finances are important, because they're an enabler and they allow you to do it. Because if you were spending a fortune and not having any money back, then somebody would want to stop you. But the fact that you're concentrating on outcomes.
I don't want to interrupt you, but I'm going to. I suppose in Scotland, we are all facing a challenge in respect of placements that are available for children. So the cost of residential care the inspection regimes for residential care, the real challenge we have right across the country, and it's not just in Scotland, across the UK, in recruiting foster carers. So there's something about how the two sit together. And again, there's a further push back in to try to look after children in their own homes where it's safe to do so.
Yeah, and there was actually a question in the chat around about if you've got a solution to the fact that there's a shortage in foster carers across Scotland, but you obviously don't have that solution.
No.
But yeah, you're right. It's something that everybody's facing. Absolutely. So just at that, I think we're just about hitting 3 o'clock right on the button. So can I thank you both for this and your input? And thank everybody that attended for taking part and asking so many insightful questions. More power to your elbow, and I've no doubt maybe in a couple of years we'll be seeing you again, Mike and Karen, at some other forum.
Thank you.
That's brilliant. Thanks very much.
Thanks.
Thank you.
Thank you.
Bye-bye.